Welcome to Focus on Health, a show that informs you on matters health. My name is Boari Michelle. This week on Focus on Health, we take you through a cancer series. In our previous episodes, we've already demystified cancer generally and breast cancer, and today we focus on prostate cancer. Prostate cancer is a slow-growing tumor that is most common in men 50 years and above. But even before we see Daktari on that conversation, let us check out the feature of the day. That was the very informative feature of the day. With me on set is Daktari from HCG CCK Cancer Center. Our topic today, prostate cancer. So Daktari, thank you very much for joining us today. But even before we head down to our topic today, kindly introduce yourself to our viewers.
My name is Dr. James Mbogo. I'm a senior registrar at HCG CCK Cancer Center here next to Mpisha Hospital along Shivachi Road.
Thank you. Daktari, let's head down to prostate cancer. How would you define prostate cancer?
Prostate cancer is basically a malignant or cancerous tumor that affects the prostate. The prostate is an organ only found in men. It's located between the bladder and the rectum. So normally we see prostate cancer. It is actually the commonest cancer affecting Kenyan men. Yeah, and the age is usually men who are in their 5th to 6th decades of life going up. And the risk of prostate cancer increases as you age. So a man who is, say, 90 years old has a higher risk of developing prostate cancer than a man who is in his 60s and 70s. Normally, we've seen even patients who are in their late 40s develop prostate cancer, though it's not so common. From around 50 years going up, then the risk starts increasing.
What are the signs and symptoms of prostate cancer? Rather, how does it manifest itself?
For all men, when we reach around age 50 going up, the prostate starts becoming big. It's something age-related. We call it benign prostatic enlargement. And when it starts becoming big, because of where the prostate is located, there's this small pipe called the urethra that comes from the bladder through which urine comes out whenever a man wants to pass urine. So sometimes, because of benign prostatic enlargement, the urethra can get blocked, and patients develop those symptoms of benign prostatic enlargement. These include waking up a lot at night to pass urine, increased frequency of urination, feeling like you've not completely emptied your bladder. So sometimes those are the same symptoms that prostate cancer may present with. Other times patients go for what is called screening. Screening is where you can go to have tests done to check for a disease, yet you do not have symptoms yet, to detect early disease. And most men have actually gone to do what is called a PSA, prostatic specific antigen. It's a blood test. They are found to have a high PSA. Then the doctor may tell them high PSA may mean you have prostate cancer. They go for further tests and they are found to have prostate cancer. So it may not have definite symptoms like, say, breast cancer, which may present with a lump, or bladder cancer, which may present with blood in the urine. Those are the symptoms we ask men to watch out for. Other times, unfortunately, some men present with cancer that has already spread. The favorite site of spread for prostate cancer is bone, especially the backbones. Some men may present with severe back pain. They may do tests such as a CT scan or an MRI. They are told it looks like they have something in the bone, which looks like it's cancer that has spread. And then further investigations reveal that it is prostate cancer. So the symptoms, the mode of presentation varies a lot. Yeah.
So Doctor, you've mentioned something about PSA. What is high PSA and what would you define as average PSA?
When we measure PSA in blood, the normal level has been reported in most labs as 0 to 4. Then the units they use is nanograms per milliliter of blood. So that a patient a person who goes and has the PSA checked, then it's found to be maybe 6 or 7. Depending on the age, sometimes we may say it may be benign prostatic enlargement. The problem with PSA is also non-specific. If you have prostate inflammation, what we call prostatitis, maybe it's an infection, it may go up. If you have prostate cancer, definitely it will go up. If you have benign prostate enlargement, it may go up. but we have seen very high levels, such that when we see a level that is above 10, we really suspect it may be prostate cancer. A high PSA does not diagnose prostate cancer. I want to clear that. Even a high PSA does not mean you have prostate cancer. Because how we screen for prostate cancer, even normally, is we will do a PSA, yes, which is a blood test. Then we have to do what is called a digital rectal examination, because the prostate is located in front of the rectum in men. So digital rectal examination means the doctor has to put a gloved finger inside the rectum and then feel for the prostate. If it's enlarged, if it's the texture, then all those may point towards, so that he may see the way he feels the prostate when he does the examination, and then a high PSA, he may recommend further tests. Like he may say, let us do what is called an MRI of the pelvis. Then the radiologist will report the prostate and say, yes, this prostate, it looks malignant. Then the final test called a biopsy, which is also done through the rectum, where they take small pieces of the prostate. That is what will confirm whether a patient has prostate cancer or not.
Dr. You've mentioned something about breast cancer, and as I was doing my research, I came across something about breast cancer having a link to prostate cancer. So if a man has breast cancer, does that, predispose you to prostate cancer?
Breast cancer is, we see it in men. It's very rare. But there's another gene. This one now I'm getting a little bit more technical. There's another gene, it's called the breast cancer gene, or BRCA, BRCA, and we have 1 and 2. Now, when a patient who has a strong family history where there is a BRCA gene in the family that is mutated, that means an abnormal BRCA gene. Say a lady has breast cancer, and then we find that she has a mutated BRCA gene. If we check the same BRCA gene in, say, her brothers or her father, and we find it's mutated, then they have a high risk of developing prostate cancer. And please note that we are saying even women who have a mutated BRCA gene, it does not mean they will get breast cancer or any other cancer. Maybe even ovarian cancer has been linked to the BRCA gene, which just means that their risk is high. So we may tell them they need to do screening more frequently. For breast cancer, we tell them maybe a mammogram, maybe annually. And then for prostate cancer, it may be what I mentioned, the digital rectal exam and the PSA levels. It does not mean that they will develop. They just have to be very, very vigilant, the symptoms I have mentioned, and then doing screening very diligently in a very disciplined manner, so that, because screening detects early disease, so that if it's detected early, it's still curable. That has been the link because of that one mutated gene called BRCA or BRCA, and we have BRCA1 and 2.
Dr. Let's talk about the causes. What exactly causes prostate cancer?
The cause is unknown. So we talk about risk factors. And a risk factor is an attribute that increases the risk of, or the chances of you developing a particular illness. So like I mentioned, age. The older you are, the higher the risk. There's also family history, such that maybe if your dad had prostate cancer, then your risk is also high. Okay, or what we call first-degree relatives. Like if your father had, then maybe the siblings and the brothers and maybe the grandfather, that they may have a higher risk of developing prostate cancer. Eating a lot of red meat has also been linked. And remember, these are risk factors, and these are the few that we know. So we cannot say that even if you eat a lot of red meat, you are obese, your father had prostate cancer. It does not mean you will get prostate cancer. It just means that your risk is high. So you can alter your lifestyle, reduce maybe your red meat intake, and you start exercising. That will lower your risk. Your father having prostate cancer, you cannot change anything about that. That is what actually we call a non-modifiable risk factor, what is family history. So we'll just encourage you, go for screening. Digital rectal examination and PSA levels.
Dr. You've talked about obesity. Does that mean that if someone is obese, that would actually predispose you to prostate cancer?
It may predispose, but it doesn't mean if you have obesity, you will develop prostate cancer. It's just a risk factor. Yeah.
Thank you very much, Dr. Hold on to that thought. We are going to take a slight commercial break, and when we come back, Dr. is going to be telling us more about the treatment and diagnosis of prostate cancer. I will leave you with the Did You Know segment.